Hi, I'm Daniel, I'm a sleep physician, and if you're Insomnia, this channel is for you. People that are using CPAP therapy for obstructive sleep apnea often notice that they have become dependent. They can't even fall asleep and get a wink if they don't have their CPAP machines. How is that possible? How can one become dependent on pressurized air just to fall asleep? We shall explore that in this episode and see how that applies to anyone that's dependent on anything for sleep. Super excited having you back here. Hope you're doing really good. It is Wednesday today, and this is episode 240. And as mentioned, we're going to explore dependency. This is really a follow-up in a way to episode, I think is 238, Valium versus confidence. In that episode, we were talking about how Chris C28 had less completely sleepless nights on a Valium type medication, and we were exploring how that, was that really kind of the drug or the confidence that really made a difference. Amanda shared that she's trying to rid herself of her dependence on benzodiazepines and wishes she had never started them. So I thought about something that I think can be helpful here. Something that I hear all the time, at least a couple of times per week, is somebody that has obstructive sleep apnea, somebody that in their sleep has the tongue falling back and they're snoring and stop breathing, and that fragments their sleep. And the treatment for that typically is using a CPAP machine. It's a device that is kind of like a vacuum cleaner in reverse, meaning it pushes out air, and that is led through a tube to a mask that then keeps the airway open so that the patient can breathe well in sleep and sleep better. Now, interesting to note is that people with sleep apnea typically actually sleep more than when they're untreated compared to when they're treated, and the reason for that is that they have poor quality sleep, so the body tries to kind of compensate by having them sleep more. When their sleep apnea is treated, they need less sleep because it's good quality, and so they actually sleep less on their CPAP. But a lot of people notice that they have become dependent, that they literally cannot sleep without their CPAP machines. People often tell me that, as soon as they put on their mask, they take a couple deep breaths, they relax, they fall asleep, which is a big difference from before, before they were treated. And also that when they are traveling somewhere and they forget their CPAP machine, they don't get a wink of sleep. They're literally up the entire night, And how is that possible? How can you go from sleeping actually more, not good, but sleeping like a lot of hours, having no problem necessarily falling asleep, to not being able to sleep at all if you don't have your CPAP machine? All it does is forcing some air into the airway. And here's why I think this is so important. It's kind of conceptually, it's often hard to convince somebody that they can sleep without their Ambien or their Lunesta or their Trazodone or their Xanax or whatever it is, and that it is the belief that they can't that is really triggering that rebound insomnia. The rebound insomnia is when you stop taking medication and then you can't sleep at all or sleep very little. It's hard to convince people of that because there are chemicals involved. You're taking some kind of pill that definitely has like a chemical effect, like it's sedating and it's doing something to your neurotransmitters in the brain. But applying this to a CPAP, we can see that people can develop the same dependency on pressurized air. So I felt it was really important to think about this. If somebody can develop the same thing, rebound insomnia, literally not sleeping at all, if they don't get their pressurized air, just as somebody doesn't get their medication, then maybe the mechanism isn't that dissimilar. Maybe it's really the same thing going on. With CPAP, of course, I'm saying of course, maybe there's more to it. This is kind of something I'm exploring, but to me, I feel it's pretty obvious that it is this strong association between sleep and good sleep and the CPAP machine, that over time it's become such an ingrained ritual that you go to bed, put on the CPAP machine, the air starts flowing, that you're going to sleep, you're going to sleep well, and you believe it, you have complete confidence in the CPAP machine, and you fall asleep. So, the sleep confidence in this case has actually been transferred from the patient to the CPAP machine. People no longer believe they can sleep themselves. They believe that the CPAP machine is making them sleep and producing sleep. So they have become psychologically dependent on their CPAP machine. And when they don't have it, rebound insomnia. They believe they cannot sleep at all with it, when they in fact could. They could sleep just like they did before, poor quality sleep, but they could still sleep and sleep actually more. And so I hope this can illustrate how that psychological dependence really is the thing. It's all about confidence. And I hope that for anyone that's taking a medication or supplement or something like that and believes that you can't sleep without it, please consider this and know that really that psychological dependence is, at least in my opinion, really the big reason why it's so hard to sleep without it. And I feel like if you start exploring this and you start like actually believing that could be the case, that could be the first kind of cracks in the foundation of this kind of construct, and that can unfold and make it easier for anybody that wants to come off a medication supplement. And by the way, nothing is medical advice here. You should talk to your doctor or prescriber when it comes to medications, of course. Was there anything to add there? I don't think so. I hope this was helpful to you, and I shall be back here tomorrow with more. Until then, take it real easy and see you tomorrow. Bye-bye.